Hello and welcome to 90 Day Dental, Day 5 with me, Laura Horton.
Welcome back to 90 Day Dental Day 5 and we're in full swing. Great session yesterday and today's gets even better. We'll be concentrating on co-discovery today, which is a great topic moving forward on how to work well with presenting to your patients as well as discussing things with your treatment coordinator, your team and your nurse. Let's take it away.
Today I'm going to be talking to you about treatment options and the discussions that you have with patients about their treatment plans. What I'd like to do actually is just take a step backwards first of all and talk to you about the examination process and something that is really important and really valuable to both you and your patient, and that's co-discovery. Co-discovery is a fantastic way to engage with your patient, for them to be able to understand what's happening in their mouth, for you to be able to understand their concerns, and for the patient to be able to understand your concerns. And this is delivered in bite-sized chunks so that the patient can digest the concerns that you have about their teeth or an area of their mouth. So one example would be missing teeth. Now, co-discovery is very much nurse-led. So the nurse would call out, are there any missing teeth? You'd look, you wouldn't chart, but you would then say, oh yes, there are 5 missing teeth. Mrs. Smith, please can I talk to you about these missing teeth? Were you aware you had 5 missing teeth? Show them in a mirror. Interact with the patient, find out the story. How did they lose those teeth? What happened? Listen to any concerns the patient has about them. And then take the opportunity to show your concerns with these missing teeth. Now, whether that's over eruption, movement, excessive wear in a different area of the mouth due to the missing teeth, whatever the clinical concerns are, explain them in layman's terms and leave the patient to digest that information while you get those missing teeth charted. And the exam continues in that way. Now, what co-discovery does is it enables you to give information in bite-sized chunks throughout the time of the examination, instead of finishing the exam, pressing the button on your chair for the patient to sit up and feeling like you've got to take a really big deep breath and go, okay, where am I even going to start? And it's overload for the patient, isn't it, as well, when we deliver everything in one go. Co-discovery is a fantastic tool that really helps you with presenting treatment options to patients. Because you've already explained the problems, they understand them. They might have more questions, which is great as well. So when it comes to explaining the solutions that you have available at the end of the assessment, this enables you to present comprehensively. So rather than go around the mouth tooth by tooth, you can present everything in one go. So as you can see, Mrs. Smith, from the results of the assessment and the x-rays that I've taken, I have got concerns with 5 teeth as they've got tooth decay. And then you can explain what you're going to do for 3 of them or 2 of them, and use photographs and radiographs to educate the patient about each one. It's fantastic. My other tips for you when it comes to presenting treatment is to really break things down. So first of all, explain all of the problems that you found in the mouth, to summarise what they are, and ask the patient what questions they have about the problems. Next, recommend a treatment plan to the patient. This is in the GDC standards. To recommend a treatment plan, it's in there, it's clear. What would you do if this patient was your brother, sister, mother or father? What would the treatment plan be for that patient? It's got nothing to do with finances, it's about the clinical way that you treat that patient. Give them the opportunity to ask questions about your recommendation. Then move on to your alternatives. Give them the opportunity to ask questions about your alternative treatment plans. And then ask them which one they'd like the sound of. Which do they think is going to suit them best and work best for them? It's a really great way to go down a consent process. You can then explain the risks associated to the treatment plan and again encourage them to ask questions. Now, This is where if you've got a treatment coordinator, they should be in the room with you, taking notes about the questions the patient's asked and your responses, so that can go into the clinical notes. If you don't have that luxury, this is where your nurse does need to remain in the room rather than running off to do some decontamination, because they need to do that vital job for you as well. They need to support you with the note taking. Lastly, you can confirm the investment for the treatment to the patient, whether it's £80, £800 or £8,000. It's really important that that is then discussed, because sometimes patients have treatments they just can't afford. So tomorrow, day 6, I'm going to talk to you more about costs and the way in which to present them to support you and handling objections that you might get. But hopefully for today, there's a few tips that you can take back to practice with you to help you when it comes to going through the treatment options with the patients. And remember, take a step back and look at co-discovery as well, because it really does support the patient in education.
Another cracking session, and back again with Laura tomorrow to finish off with finances, before we have a really exciting session coming up with Shaz Meemon from Digimax. Really looking forward to that one. Until then, see you tomorrow.